This gut liver hack could revive your health after 60. Imagine waking each morning feeling sluggish, bloated, and battling persistent fatigue symptoms that stubbornly cling long after you've turned 60. What if I told you the root of this malaise isn't in your liver alone, but in the trillions of microbes lining your gut? Welcome to the world of the gut-liver axis, a two-way highway where intestinal health dictates liver function and vice versa. In this comprehensive deep dive, we'll explore how nurturing your gut microbiome can be the cornerstone for reversing fatty liver, reducing inflammation, and reclaiming vitality well into your golden years. 1. The gut-liver axis defined. The term gut-liver axis describes the intimate anatomical and functional relationship between the intestine and the liver, connected by the portal vein through which 70% of gut-derived blood flows directly to the liver. PubMed. This highway carries not only nutrients but also microbial byproducts, some beneficial, others harmful. When gut barrier integrity falters, bacterial endotoxins like lipopolysaccharide, LPS, translocate into portal circulation, triggering hepatic immune activation and chronic inflammation (PMC). 2. While leaky gut sparks liver damage. 1. Tight junction breakdown. Normally, intestinal epithelial cells link via protein complexes, tight junctions, that regulate permeability. Aging, a Western diet high in processed fats and sugars, and certain medications weaken these junctions. 2. Endotoxin spillover. OLPS, a potent inflammatory molecule, crosses into the portal vein, where Kupffer cells, liver macrophages, recognize it via toll-like receptors, TLR4, unleashing cytokines TNF-alpha, IL-6, and IL-1 beta. PubMed. 3. Chronic low-grade inflammation. This sustained immune response contributes to insulin resistance, hepatic steatosis, fat accumulation, and fibrosis, laying the groundwork for non-alcoholic fatty liver disease, NAFLD, and its progressive form, non-alcoholic steatohepatitis, NASH, PMC. 3. Probiotics, seeding your gut with good bacteria. What are they? Probiotics are live microorganisms, most commonly strains of Lactobacillus and Bifidobacterium that, when consumed regularly, confer health benefits by competing with pathogens. Probiotics crowd out harmful bacteria, reducing endotoxin producers. Strengthening barrier function. They upregulate tight junction proteins, occludin, zonulin, enhancing mucosal integrity. Health line. Modulating immunity. By interacting with dendritic cells and T cells, probiotics shift the immune milieu toward anti-inflammatory cytokine profiles. Clinical evidence. A randomized controlled trial supplementing Lactobacillus rhamnosus for 12 weeks in older adults with early NAFLD showed a 20% decrease in serum ALT levels and significant reduction in hepatic fat content measured by ultrasound (PMC). Patients also reported less abdominal discomfort and improved bowel regularity. 4. Prebiotics, feeding your native gut flora. Definition and sources. Prebiotics are non-digestible fibers such as inulin and fructooligosaccharides, FOS, that travel intact to the colon, where resident microbes ferment them into short-chain fatty acids, SCFAs, like butyrate, propionate, and acetate. Cleveland Clinic. Key dietary sources include onion, garlic, leek, rich in inulin. Asparagus, banana, oats, good FOS content. Mechanisms of action. SCFA production. Butyrate nourishes colonic epithelial cells, reinforcing tight junctions and mucus production. pH modulation. SCFA's lower luminal pH, deterring pathogenic growth. Indirect liver protection. Propionate enters the liver via portal circulation and has been shown to modulate lipid metabolism, reducing de novo lipogenesis. 5 fermented foods, daily probiotic powerhouses. Incorporating Greek yogurt, kefir, kimchi, and sauerkraut into your diet provides a diverse spectrum of beneficial strains. A cohort study of adults over 65 who consumed 150 g of unsweetened Greek yogurt daily for 8 weeks exhibited a 30% drop in systemic LPS levels and notable improvements in self-reported energy and digestive comfort. Lifeextension.com. 6. Tailoring supplementation, strain selection and dosage. Multi-strain probiotics. Choose supplements listing at least 5 strains of Lactobacillus and Bifidobacterium, with a minimum of 10 CFU per capsule. Prebiotic synergy. Look for products that pair inulin or FOS with probiotic blends to ensure both seeding and feeding functions. 7. Integrating lifestyle for a robust gut, liver axis. 1. Hydration. Aim for 1.5 to L of water daily to support mucus layer integrity. 2. Gentle movement. Walking, yoga, or Tai Chi for 30 minutes each day enhances gut motility and reduces visceral fat. 3. Stress management. Chronic stress elevates cortisol, which disrupts gut barrier function. Practices like meditation or deep breathing can mitigate this effect. 4. Mindful eating. Chew slowly and avoid overeating to reduce small intestine bacterial overgrowth, SIBO, risk. 8. Real-world case study. Mrs. Johnson's transformation. At 68, Mrs. Johnson was diagnosed with early NAFLD after routine blood work revealed elevated ALT and AST. Her primary complaints included afternoon brain fog and nocturnal heartburn. Over 16 weeks, she adopted a gut-centric protocol. Daily morning smoothie with 1 tablespoon inulin powder, spinach, and berries. 150 g Greek yogurt post-lunch. Probiotic supplement, 5 strain, 10 CFU, at breakfast. Evening 20-minute walk after dinner. Outcomes. Liver enzymes. All dropped from 65 U/L to 32 U/L. AST from 58 U/L to 29 U/L. Ultrasound. Hepatic steatosis grade improved from mild to minimal. Quality of life. Reported 50% reduction in midday fatigue, improved sleep onset, and virtually no heartburn episodes. 9 precautions and gradual introduction. To minimize gastrointestinal discomfort. Start low, go slow. Begin with 2-3 g of prebiotic fiber per day, increasing by 2 g each week until you reach 10 g. Monitor tolerance. Track symptoms in a daily journal, adjust intake if bloating or cramping persists. Consult your physician. Especially important if you're on immunosuppressive therapy or have a history of SIBO. 10 Conclusion and practical takeaways. Your gut microbiome is much more than a digestion helper. It is a dynamic ecosystem that partners with your liver to regulate inflammation, metabolism, and detoxification. For those over 60, harnessing this gut-liver axis can translate into a lower liver fat, improved energy, and a better quality of life. Action steps. 1. Incorporate a daily fermented food. e.g., Greek yogurt, kimchi. 2. Add 5-10 g of prebiotic fiber via whole foods or powder. 3. Supplement with a multi-strain probiotic, greater than or equal to 10 CFU. 4. Support with hydration, gentle exercise, and stress management. By nurturing your microbiome today, you're fortifying your liver's resilience and setting the stage for vibrant health in the years to come. Disclaimer: this article is intended for educational purposes only and does not constitute medical advice. Always consult your healthcare provider before making changes to your diet or supplement regimen. The content reflects current scientific understanding and reputable sources but may not apply to everyone.